I think the mistake people make is they try to become proficient at adapting to change, when your attitude really has to be exploiting change. If you just try to adapt to change, it's a defensive battle. You're driving down the highway and your lane clogs up, so you try to change lanes, nobody lets you in, you finally find a space. That's adapting to change. But if you want to exploit change, get off the highway and get on a better route. If you have to build a new road, you should use disruption and volatility as offensive weapons, not as something to be feared. Any strategy in place pre-pandemic, by definition, can no longer be effective today. You've got to change the strategy. You've got to come up with something else. Well, I've never seen an organization that had happy customers and unhappy employees. And consequently, if you want people to trust the hospital, if you want patients to feel well taken care of, the employees have to feel trusted and well taken care of.
Welcome to the Healthcare Leadership Experience, a place where healthcare leaders will share proven strategies and innovative approaches to leading the clinical and business side of healthcare. This show is sponsored by VIE Healthcare Consulting, who has proudly helped hospitals save over $700 million in non-labor costs since 1999. Here's your host, Lisa Miller, founder and CEO of VIE Healthcare.
Hello, this is Lisa Miller, and I'm the host of the Healthcare Leadership Experience. Today is an exciting day. It is the first episode. Welcome. Our guest is Alan Weiss, and he is the founder and CEO of the Summit Consulting Group. His clients have included Merck, Hewlett Packard, GE, Mercedes-Benz, and over 500 leading corporations. He has also consulted with hospital and healthcare systems. Alan has written over 60 books on consulting strategy, innovation, and leadership. He is my advisor and mentor. We had originally recorded the show a week ago, and the show didn't record. Yes, I did press the record button. And the second recording, which you will hear today, was done through a winter storm and has some internet interruptions. So please bear with the technology glitches because the content is tremendous. The lesson is we can't always control our environment, but we can control how we handle ourselves through the uncertainties of life. We need to pivot, learn, and move through the obstacles. As Alan always says, progress, not perfection. On today's podcast, you will hear Alan giving his insights and experience on why healthcare leaders should have an advisor for new ways of thinking and new insights and innovations, and also to tell us the things we need to hear that may be uncomfortable to us, but we need it for improved outcomes and results. Why exploiting change is better than adapting to change. How bringing social proof to communicating with patients is the best way to bring them back to feeling confident about having elective procedures during the pandemic. How focusing on hospital discharging is a hospital's number one opportunity for communication improvement. It is such a critical time for patients and their families as they are leaving the hospital. That last impression and the one with so many consequences, medications, appointments to follow up, care, equipment, and an overall understanding of the diagnosis and the healing process. If you'd like to learn more about VIE Healthcare, please go to our website at www.viehealthcare.com and schedule a call with me to learn how we can support and accelerate your margin improvement and cost savings goals. Let's get started. Good morning, Alan. It's great to have you on the Healthcare Leadership Experience. Really excited to have you on our first episode.
Good morning, Lisa. Happy to be here. Happy to kick it off.
Great. Thank you, Alan. So I want to jump right into your role as an advisor for consultants, consulting firms, hospitals, healthcare organizations, Fortune 500 companies throughout the world. You've been an advisor. And one of the questions I have for you is twofold. Can you give us some insights on to why it's so important for healthcare leaders to have an advisor, not just to tell them the areas where they can innovate, but maybe have those tougher discussions sometimes, the things that they need to hear and why an advisor is so important. And I say that because you're my advisor and you have given me great advice on innovation and insights, but you've also had to talk about things that I needed to hear to be a better business owner and a better consultant to my hospital. So I just wanted to get your insights on why it's important.
Everyone needs advisors because they need frames of reference from outside of their immediate reality. So no matter what kind of business you're in or what kind of professional you are, you need advisors. But it's especially sensitive for hospitals because the more you're dealing with urgency, urgent care, for example, first responders, life and death and so on, there's a natural tendency to ignore things that don't immediately pertain to health and safety and so on. But the fact is that if hospitals and healthcare organizations are going to be effective, they've got to be well managed. They've got to be efficient. One of the things you do is help reduce costs in these organizations without reducing quality, in fact, improving quality in many cases. So people who have great passion for what they do, whether it's medicine or teaching or firefighting or whatever it is, newspaper reporters, they often tend to put passion above all else. But the issue is your passion is best applied when the business is run well.
That's great. I love that. Can you give us some aspects or characteristics of a quality or a great advisor if they're going out and looking for an advisor or a strategic mentor or coach?
Well, the best advisors have widespread experience. They need to bring a perspective to any single client. So consider taking a widespread view of things and like a laser focusing it on a particular area of need. So just because someone is a coach, for example, doesn't mean they're going to be a good advisor. Just because somebody's a consultant doesn't mean they're going to be a good advisor. Ideally, an advisor should be someone who is seen as a peer of the person or people being advised at the very least. So if it's the senior management, it should be a peer of senior management. Also, the advisor should be somebody who is not especially strong in content in that particular organization. In other words, organizations are overflowing with content experts. You need somebody who knows a lot of different things from a lot of different organizations, because effective management and productive operations, well, that's a process. When I was first talking to Mercedes-Benz North America, the vice president says, what do you know about auto dealing? And I said, it really doesn't matter. You got auto experts in the hallway here. I have to trip over to get to your office. What you're not doing well is customer service. And that I can advise you on.
Great, Alan. Thank you. The other topic I wanted to cover with you this morning is adapting to change. Healthcare, as well as our whole world, has had such change. And can you talk to us a little bit about how we can adapt to change? Because this year has taught us better than anything, something like a pandemic can come and really just create upheaval in healthcare as well as all our lives. But that's going to be probably a constant. It probably has been to a lesser degree, and we haven't realized it as much. But can you give us some insights on how to adapt to change?
Well, I think the mistake people make is they try to become proficient at adapting to change, when your attitude really has to be exploiting change. If you just try to adapt to change, it's a defensive battle. You're driving down the highway and your lane clogs up, so you try to change lanes, nobody lets you in, you finally find a space. That's adapting to change. But if you want to exploit change, get off the highway and get on a better route. If you have to, build a new road. And so what happens is, you take a look right now, some people have adapted to change by allowing people to work at home, but exploiting change to me is using Zoom and other media like it to create meetings, to create interactions, to make sales, to service people. And telehealth as an example, wherein they're exploiting technology, wherein I think they'll last well beyond the pandemic. They'll last beyond the forces that created these needs. So I think the mistake people make is, oh God, change. How do we adapt until things go back to normal? Things aren't going back to normal. And I'll even make a case that if you look at disruption and volatility, which are always talked about together, should be the name of a law firm, right? Disruption and volatility. You should use disruption and volatility as offensive weapons, not as something to be feared. So it's about exploiting change. That's how you come out on top.
Thank you. That's a big insight. I would agree with that. Thank you, Alan. Can we talk a little bit about something that you've been sharing with all of us, that is any strategy pre-pandemic is not going to work, and just talk about how hospitals really have to think about strategy in a new way now. And you've been sharing a lot about pre-pandemic strategy isn't going to work now.
Well, I think there's going to be a huge business rebirth along about March, April, or May, somewhere in there next year, 2021. So what happens is any strategy in place pre-pandemic, by definition, can no longer be effective today. You've got to change the strategy. You've got to come up with something else. I talked to somebody the other day and they said, well, look, we can't talk right now because we're in the second year of a 3-year strategy. I said, that's exactly why you should talk. If you're in the second year of a 3-year strategy that began pre-pandemic, you're going downhill at a rapid rate right now. Conditions have totally changed. And some conditions that change are permanent. So you have to take as a reality that a strategy pre-pandemic is no longer going to help direct the organization. You have to create a new one. You can't take a look 3 years out or 5 years out, or you might as well guess or use a magic 8-ball. You have to look about a year out and make some decisions about the nature and direction of your business.
Absolutely. I have a couple more questions for you, and I want to let the audience know you've got a great book called Fearless Leadership. And can you just share some insights, because it's probably very timely too with healthcare leadership. I think reading your book, and you have other books like Leadership Every Day. But can you talk a little bit about Fearless Leadership, please?
I looked at why people don't charge more for their services, and I realized they often didn't have the self-esteem to charge more. They felt like imposters and they couldn't charge more. And that's businesses and individuals. But then I asked, why was that? Well, there's a fear, and a lot of people fear that they're going to be rejected. And so they don't do their best. They don't offer the most. They fear that there's going to be some kind of scorn or critique of what they've done. One reaction to this, Lisa, is they procrastinate, because the fear of being critiqued for not getting something done is better to them than the critique of doing something and being critiqued for the result. And so procrastination is basically fear-based. And people have what I call overt and covert fears, and the overt fear is of being castigated or being mocked or being humiliated when, I've never walked into a buyer's office and lost money. I mean, I might not get the sale, but I'll learn something, but nobody's shooting at us, right? But we create now these sort of imaginary fears we should have, like there's a monster under the bed waiting for us. The covert fears are the fears we don't even articulate well. We're not consciously competent. But, a parent told us 20, 30, 40 years ago, you'll never amount to anything. And no matter how successful we are, we still feel we're not amounting to anything. We've got to root these things out and deal with them. And I've found one of the worst impediments to anyone's success is their own spoken and unspoken fears. And they need to get them out on the surface and deal with them.
Great, thank you. So one aspect I see as an opportunity for hospitals is communication. And it's how we are communicating during COVID and having patients want to come back, but yet there's a fear of maybe contracting the virus versus making a really safe environment. Can you talk about communication and, how hospitals should be, or maybe enhancing or improving how they think about and communicate safety and patients coming back and their families, and just, how do they do that well, Alan?
Well, people are leery of communications because if you look through this crisis, which is now, in its 10th month, I guess, people have been told a lot of things which was simply not true. I'm not talking about fake news. I'm not talking about anything like that. I'm talking about scientists and medical people, as well as politicians. People have just been told things that were not true because the decision-making processes here all along have been terrible. The critical thinking skills have been terrible. So they weren't malicious lies, but they were untruths nonetheless. So people are leery. I think the important thing is social proof. Recently they said, 3 ex-presidents were going to get the new vaccine. Now, I don't know how much faith that gives people, but the intent there is social proof that the vaccine is safe. I think if you did it with some celebrity sports figures, it would probably be much more effective. They wouldn't want to be threatening their careers by getting the vaccine. So I think you have to have social proof. You have to demonstrate to people. Recently here in Rhode Island, they set up 2 field hospitals. And people were very concerned about going to a field hospital, not a regular hospital. And the idea was the field hospital would take care of the less seriously ill, freeing up the more intense procedures in the regular hospitals. Well, the media interviewed some people who went to these field hospitals, and they were raving. And they said, the care is excellent. You can walk around, you can make calls, you can do this. We felt, like royalty. What treatment? Well, when they did that, and these were, just 2 people, everyday people, you could see the reaction was, okay, then if it comes to that, I can do that. So I think we need that kind of social proof. I think we need to be extraordinarily honest and admit the fact that there's going to be an occasional, let's say, adverse reaction to the vaccine, but it's going to be 1 in 20,000 or whatever it is. But that's the key. People look for, after they feel that there's been a communication, that there's proof that it was true, or there's proof before the fact that they can rely on it.
Right. So a great idea might be, patients have gone through the hospital, whether it's the ER or surgery, having some kind of campaign saying this was a spectacular visit. I felt safe, and really hearing that from an individual level, right? Individuals coming into a hospital, as well as you're saying, we need social proof.
I'll tell you something, the first and last person you see in a hotel is a doorman. And the doorman makes the biggest impression on how he welcomes you and then how he sends you on his way. In a hospital, many people have a terrific experience. The nurses, the transport people, the technicians, the doctors are all wonderful, but discharge, which is awful. And the last thing they remember is discharge. And I don't think hospitals pay nearly enough attention to graciously and professionally moving people out of the hospital and back home again. And I think that's one weakness they have to think about.
Yeah, I agree with you. I think discharge needs to be an area of incredible focus, because it is that last impression. And it's so important because the patients have to do so many things as they go home. And I agree with you. That whole discharge process could be a big opportunity, a big win for hospitals. So Alan, thank you. I do appreciate that insight. So as we wrap up, is there anything that you'd want to share in terms of, giving healthcare leaders some advice or something as they go into 2021 that they can think about? We'd love to hear from you, Alan, because you see opportunities, you see trends, or you see where we need to, to kind of focus our attention. And if you had some thoughts that you could share for 2021 for our listeners.
Well, I've never seen an organization that had happy customers and unhappy employees. And consequently, if you want people to trust the hospital, if you want patients to feel well taken care of, the employees have to feel trusted and well taken care of. And so I would put a lot of attention on all employees in the hospital, no matter what their jobs, to make sure that they're being heard, to make sure that they're being treated well, to make sure they're recognized. It's not really compensation that motivates most people. It's having some latitude of action, applying your talents, and being recognized for it. So I would pay attention to that. The second thing I'd say, since you're giving me the opportunity, is there are going to be two major hurdles in the near future. One hurdle is the various governmental units saying it's now safe. You can dine, you can visit, beauticians and get massages and go to the gym. You can go to the movies. We can open the theaters. So the government has to okay that. But the second hurdle is people's perception that it's safe to do that. And so I think that healthcare has to work closely with the media and closely with the government agencies responsible to give reassurance to people that it genuinely is okay, that it's not a political decision being made, it's a scientific and medical decision, and that will revive the economy and that will revive everyone's best fortunes. So, that's my opinion.
Great. Alan, thank you so much. I appreciate your time today and just having a discussion with those that are on our podcast, and we look forward to having you back. So thank you.
Thanks a lot. Good luck with the series.
Thank you for listening to this episode of the Healthcare Leadership Experience. If you enjoyed today's show, please leave us a review. Your reviews help other healthcare leaders find this podcast and see the value that it provides. If you're a healthcare leader who would like to be on the show, or if you'd like to listen to more episodes and view our show notes and resources, please visit us at thehealthcareleadershipexperience.com. Thank you for listening, and we'll see you again next week.